You're watching ABC4 News.
Welcome back. Utah researchers say that hydroxychloroquine shows no benefit in treating COVID-19 patients. Now, early on during the pandemic, the drug was talked about as a potential treatment for the deadly virus. But as ABC4's medical correspondent Saray Chen reports, those researchers have ruled the drug out as a viable treatment.
At the start of the pandemic, scientists were racing to find a treatment. Hydroxychloroquine received the initial buzz. Doctors hoped it would be the answer.
I think there was this mixed sense of like, oh, this would be amazing if it worked. Turns out that it does not work. It doesn't have the efficacy that we were looking for, but I think it's really worthwhile that we did the study to find that result.
Researchers, including here at Intermountain Healthcare, put the brakes on unleashing the drug to the masses after several international and local studies.
The last thing we want is a dangerous medicine to sneak through the system.
In a new study, researchers from Intermountain Healthcare and University of Utah Health found hydroxychloroquine provided no benefit to COVID-19 patients when compared to azithromycin or the Z-Pak, an antibiotic used to treat bacterial infections. The trial ran parallel with the National Institutes of Health trial, which Intermountain Dr. Samuel Brown co-chaired. That study compared hydroxychloroquine with a placebo. The study abruptly stopped after finding its ineffectiveness in treating COVID-19. Dr. Samuel Brown specializes in critical care medicine at Intermountain Healthcare. He participated in both trials on the local and national level.
We worried very much that if you just gave everybody hydroxychloroquine without safety monitoring, without thinking about which patients have the good risk-benefit analysis in favor of hydroxychloroquine, you might kill people. So we were doing two things at once. We were trying to answer scientific questions, and we were also trying to meet a public health need, which was to prevent the people of Utah from rampant overuse of a medicine that might be toxic if it's used outside of a restricted population.
Intermountain infectious disease pharmacist Whitney Buckle and her team were instrumental in gaining access to the medicine, monitoring safety and dosage of the drugs used in the trial.
I'm proud that we were able to, although we didn't see efficacy, we also didn't see any safety concerns, and I think that's because we were heavily involved.
The results of those two big trials, one in UK, that was Recovery, and one in the United States, that's Orchid, those results suggest that what we did here in Utah is a kind of Utah proud moment with the HAPS trial actually likely saved lives, because we know if you use it without any oversight, if it just gets put into the water supply, basically, it'll hurt people.
Because of the incredible collaboration, hydroxychloroquine has been ruled out, giving way to the possibility of studying other drugs.
I think azithromycin is of potential interest. There's a chance it might be helpful.
The message is that we haven't lost hope and we're still looking. We're still looking and doing studies. We just haven't found it yet. And so I think right now our greatest hope is a vaccine that will really help reduce people from getting sick in the first place.
The teamwork also showed in times of crisis, Intermountain researchers can balance the urgency, rigor, and find creative ways to conduct life-saving research.
On the science side and on the answering questions in a rigorous way side is really doing fantastically well. I'm really proud to be a Utahn in that respect. The fact that we can't get our acts together to interrupt the cycles of transmission right now is not making me proud to be a Utahn. But we'll get there.
Saray Chen, ABC4 News.
Coming up.